So in this tutorial, we're going to show you how to place orders for sexual assault exams. So what we're going to do at this point is we're going to go over to the far left blue bar and select orders. And then we're going to go over to our very familiar and friendly blue plus sign and we'll select add. And then in this search bar here, we'll type in SANE. And we've created our own SANE order set here. So we will select SANE orders. Now, the most common medications and lab testings have been auto-checked and auto-selected. And the other thing that you need to know is this blue circle with the white X means that there is missing documentation that we need to update. So what we'll do is we'll come over here and we'll, at the far bottom right, we will select orders for signature. And we will include our physician or medical director's name. And we will select protocol or standardized procedure cosign. And we'll select OK. Now, if you notice again, the blue circle with the white X's indicate that there is missing information, and that shows up here at this bottom button where it says 9 missing required details. So the ceftriaxone in blue highlight here, we're going to be the first one to kind of fix. So the orders need a diagnosis, an ICD code. And so we want to make sure that we're using Z11.3, and this is encounter for screening examination for sexually transmitted disease or screening examination for sexually transmitted infection. If you note, they're both the same ICD code, Z11.3. And we will use this code for all orders. It's very generic, it's very nondescript, and it's very benign. So we will come down to the next one, lidocaine. Until the trouble ticket is resolved, there is an error here where it's autofilled to 10 ml. So we need to fix that. So down here at the bottom, it already has it up, the Z11.3, and we just click the box, and then we can go to details and change that 10 to 2. All right, great. So now moving down the list, the azithromycin, check the box. All right, dose looks great, 1 gram. And then we'll come back to the laboratory. Again, check encounter for Z11.3, chlamydia. That's good. Just keep coming here. I think you can also highlight them, and then you can check, and that'll show up for everybody. So you can just highlight the whole group and plug in Z11.3, and that will fix it. You will select sign. And because we said that the patient was allergic to penicillin, it automatically comes up with a warning for an allergy reaction, a symptom rash. At this point, you would reach out to the medical director or the senior nurse on call and determine if it's safe to continue or if you have to remove the order. At this point, we will go ahead and continue. And this is why it's important to determine patient allergy and medication. So now we have a request to please refresh the screen, and to do that, at the far right here, the little arrows, then a circle, it says refresh, so we'll select that. And our orders are refreshed. So here we are. Now, as you can see, the medications are ordered. However, the labs say that they're future on hold. Okay? Let me show that to you where it says on hold. So what we need to do is we need to activate these orders. So we'll highlight them, right click, and activate. And when we activate, we have to sign them again. So we'll sign and sign. And then we can refresh the screen again. And you've just ordered the medication. The last thing that we need to do for this is go to the task list on the left-hand bar and select task list. And this is your to-do list essentially. As you can see, we've already completed the suicide risk assessment and the medical intake, and we just need to document that we gave our medication and collected our specimens. So we're going to check that we gave the azithromycin and the ceftriaxone. And for the ceftriaxone, because it is an intramuscular injection, it is going to ask where we gave it. So in this example, we went ahead and gave it in the left vastus lateralis muscle. And then we check the box. And then we'll just select that we collected everything. We collected the aptema, a section, the vials, that's for the gonorrhea chlamydia testing. And we hit OK. And then we can hit refresh one more time. And then we can come back to ambulatory workflow. And that is how you create and activate orders for your patient in Cerner.